malaria, upper respiratory tract infection, typhoid. Those are still the major killers of Nigerians. So if you are talking of open heart surgery, renal transplant, and all those things, but
how
we have
many
to
patients require
exactly.
open heart surgery?
So those things are needed, but we
treatment?
should not neglect the basis. The basis. That is all we are saying.
So in terms of the statistics then, when you look at that statistics, what does it point to? How does it stack up for you? Are you saying 70% of your patients are more in need of the basics, or 80 or 90%? How do you calculate
Yes, I will say about 70%. The majority, the overwhelming majority, that is what in. For instance, if you come to the emergency, if you admit, like, let's say 50 patients in a day, about 60% of them will have issue with infectious diseases, and also then there are some other areas like stroke and some other things that you don't need sophisticated equipment to manage. You only need basic facilities to be available. That's what we are talking about. So in as much as we are advancing, but we should make sure that we don't neglect those who need the major things.
When you keep saying we don't neglect, are you implying by any chance that the management of the hospital seem to be neglecting those basic facilities and accumulating more sophisticated equipment as against making sure that those basics are taken care of?
But you can see the evidence yourself. So you understand? It's not nobody is cooking up any story. What we are saying is that those basic things are being neglected. It's just as simple as that. Because if you look at the reports that you just air now, you can imagine the circumstance and the situation. Sometimes patients, when you admit them on the ward, and the environment and all this, sometimes those beds may not even have a rail. Sometimes some of them can fall off from the bed. So we are saying that,
like one of
yes,
the patients
we are
said.
saying that the management should not neglect those basic things and be focusing on big issue when most Nigerians are still battling with the basics at the basal level. Yeah. So nobody is saying that you should not go into laparoscopy surgery or open heart surgery or all those things, but don't forget the majority. Don't neglect the majority. Let there be enough drug in the hospital. Let there be water supply in the hospital. Let there be beds comfortable for the patient. So those are what we are talking about. Let there be water and soap for doctors and every other person to wash their hands. Let there be file. Let there be case file for patients. Sometimes we have to use our money to buy all those things, photocopy all this. So those things should not be heard of in this kind of setting.
What is the situation with power in the hospital?
Well, the situation with power, what I can say is that Nigeria generally, you see, the power situation in the country is nothing to be right about.
The hospital is in Mushin, it's not in America.
Yes. So
in
that case, it's going to be very difficult for us to blame the hospital management.
Okay. Now,
but they are trying. They have generators here and there. However, the issue is that the power situation in LUTH is very bad.
Very bad.
Now, what is the position with the operating theaters? Is there any special arrangement for those sensitive areas?
Yes. We have the central theater is a modular theater. Okay. It has a generator that is attached to it. Okay. So, and most of the time, the generator works. So, those sensitive areas, they have generator attached to them. You see, but sometimes we have situation where, when generator is working, it breaks down sometimes. Yeah. So the main generator that is supplying the whole hospital has broken down several times. So sometimes we even sleep inside darkness. So that's what we are talking about. So those things should be available.
Okay. Let me ask Mr. Adegoke, who are the members of your union?
Okay. Basically, I represent 4 unions: Medical and Health Workers Unions of Nigeria,
which are comprising of what kind of people?
They are mostly junior workers. They also have some senior staff members
What's
among
their
them.
profession, whether junior or
They
senior?
are general health workers. They cut across from admin to maintenance, that's engineering, to engineering, yes.
So which
That
are the
area,
other three? Which
then
are the other three unions?
Nigerian Association of National Association of Nigerian Nurses and Midwives, which comprises of nurses basically. The non-academic staff union, which also cover the area that the medical networkers union cover. And then we have the Senior Staff Association of Teaching Hospital, Research Institute, and Associated Institution. That is the senior staff that from Con S6, which is grade level 7 and above, which cut across pharmacists, medical lab scientists, dietitians, physiotherapists, various professional cadres, including those in maintenance, engineering, admin, that's administration, finance.
So all four unions are on strike at the moment.
Exactly.
So how is the hospital being run, or is it shut down completely at the moment?
Well, we have some skeletal services like intensive care unit. We still have the full cream of staff working there.
Are they members of the union or
yeah,
non-members?
they are. We just we just give that concession that those people should stay there. So intensive care unit is still on, and then the donors clinic and the blood bank, because there could be accident cases and somebody need emergency blood. Those ones are still there.
Is the emergency unit open?
Well, emergency unit is, well, I would just say maybe skeletal services going on there because our members have been pulled out. So if you see anybody there, maybe few hands are just there, just to render skeletal services.
And they're not your members, they're people
They
the
are
hospital
members.
has.
They are members. Just not to close the whole eyes. That's just
Okay.
the case.
Mr. Negoke, I see here that one of the things that you're complaining about is dirty environment in the hospital. And we could see that from the...
It's obvious.
Yes. What kind of discussions have you had, or have the management had with you regarding rectifying this particular problem? Because this has the possibility of affecting the psyche of a sick person who goes to a hospital.
See, it's unfortunate. The people who are actually doing this work with the whole of their heart, whether it's downsized or right side, but these people were laid off. And they just brought in some companies. And most of these companies that will sublet contract will employ people. Perhaps maybe the hospital will pay per head. I don't know how much they pay per head, but some of these companies will pay them far less. So that commitment that used to be there is not there again. And to me, I would advise that they should bring back permanent staff to clean. And they know that they have stake, they know that they are pensionable, the whole of their heart will be there to do the job. But somebody who is cleaning, who is not sure of the take-home pay, will be able to take him or her home. Definitely the person will be thinking of how to make up. And that commitment will not be there.
But then that's not an acceptable excuse for anybody to not do their job properly.
Well, it's a pity. But that's what we are seeing. And if the company is not performing well, it's up to the management to decide, evaluate them, and tell them to move, and then look for a company that can do it. But I would recommend that permanent staff be returned to that, because cleaning, that is the place where hospital work starts from. You can't work in a hospital environment that is what is called nosocomial hospital infection if the cleaners are not there. To me, cleaners, I will call them the king of the center, because if they are not there, if their work is not effective, the work that the rest of us do will amount to zero. It will amount to simple physics, simple principle in physics. When they say, when a simple pendulum oscillates left and right and come back to the middle, work done is zero. No matter how much professional effort we put, if cleaning job is not taken as important the way it should, our work will amount to zero because people will come to the hospital for one case or the other and go back with more terrible infections.
Okay. All right. So in wrapping up then, Dr. Omojola, what are your thoughts and where do you see this going now, considering the fact that Ministry of Labour has been good and proactive and come into this conversation with you, and they're helping to negotiate and bring it to an end? How do you see this panning out in the coming days?
Okay. Before I answer that directly, I would like to say that our house officers, those are the junior doctors, we have asked them to continue working in conjunction with the consultants. So, in order to take care of some patients that are already on admission. So, it's not as if we just shut down the whole place. So, because those who were admitted before the strike started, we have the responsibility to take care of them. So, we have given that concession for that to go on. Now, as per the issue of the Ministry of Labour intervention, I believe that on all our demands, the management have actually they've done. Let me say, I can give them close to pass mark in terms of addressing the issue. So the grey area eventually was sorted out yesterday at the ministry. So we just hope that the management will keep to their side of the promise, of the agreement. And if that is the case, I believe that by Monday, when we call the Congress and we table all these facts, I believe that strongly that this matter will be resolved.
Okay, is that the same with you?
Well, I will passionately appeal to my members too when we get to our meeting. And I believe they are Nigerians and they are people who are also passionate about care. And I believe that they will reason. They will reason. At least we have more promises, and we believe that the management will be gentleman enough to keep to their side of the promises.
All right, thank you very much. Thank you very much. So we've been speaking with Mr. Kende Adigoke, the chairman, Joint House Unions and Association of Lagos University Teaching Hospital. Thank you very much for coming on Sunrise this morning.
Thank you,
And
sir.
also Dr. Olubunmi Omojowola, President, Association of Resident Doctors at the LUTH. Thank you very much.
Thank you, sir.
Again, we reiterate the fact that we did try to get Professor Akin Oshibogun on the program, and he has committed to come on the program as soon as possible, which will be in the coming weeks. And we're looking forward to have him here. Whether the union issues are resolved or not, we're looking forward to having him here. Sunrise will take a break now, and when we come back, another interesting conversation coming your way. So please don't go away.